Hello and welcome to my Facebook page, Together We Can Ottawa, a Facebook page that I did as a self-initiative to reach out to the community and spread the awareness and to drive a positive health outcome in the community we live in during the COVID-19 pandemic. As dental offices start to reopen across the country, the guidelines vary from province to province, but the concerns remain the same. Having the right protocols and enough protective gear to safely see patients, and seeing enough of them so they can keep the office running. So all this left people with plenty of questions. To answer some of them, we are joined by dentist Dr. Ghamian. Good evening, Dr. Ghamian, and thank you for being our guest tonight.
Good evening, Tarek. It's a pleasure to be here.
For our live broadcast viewers, if you have any questions, you can post them in the comment section of this live. So, Dr. Ghamian, a lot of change in the last 3 months. Dentists had previously only been allowed to practice emergency cases or urgent care. And like lately now, they can offer essential services with enhanced precautions. So will it be safe to visit dentists when their offices are reopened?
Great question. First of all, dental offices employ a lot of the same sterilization protocols that hospitals employ. So they tend to be among the safest places for people to visit in terms of infection control. But the difference is in hospitals, people go there are the ones who are sick. In dental offices, people go there are the ones who are healthy, for the most part, of course. So we tend to be quite a low risk area of getting infections in the first place. With the current pandemic, all dentists are taking extra precautions to ensure the safety of both the patients that are coming to the office as well as the team that's actually there to serve them. So it is safe with the precautions that we have installed in place, according to the Dental Association of Ontario, which is what Dentists Ontario follow.
Okay, nice. So, like, what will be different, or like, what is being changed, or what is changed already?
Great question. So, I mean, a lot of us, as we're doing our shopping, as we're going to different places, we're noticing, we have to observe social distancing. There's a limited number of people allowed inside any facility, whether it be a restaurant or not even a restaurant, I mean, a grocery store or other places of this like that. Similar thing with a dental office, there will be screenings done for people before they come in, except it'll be a little bit more stringent and a little bit more organized. So, for example, when say, Tarek, you want to go see your dentist tomorrow, your dentist would have called you today, asked you a series of questions. They would ask you about your health, if you've been in contact with anybody who has COVID symptoms in the last 14 days, if you yourself had any symptoms. They would have asked you if you had any travel outside Canada. Assuming you answered no to all those questions, the next day you'd show up at your dental clinic. You would be surprised to see that the waiting rooms are usually off limits. You'd walk into an area like what you see in the picture before you there. One of the dental team members will ask the patient.
Sorry, doctor. So I will be adding some photos that you shared with us about the clinic. So while you are like explaining for us about that.
So, like for example, this is where people will come into our office. That's the first area that you come in. It's at the door. We'll ask them the same series of questions we asked the day before. Again, if they've had any symptoms of that, like fever, runny nose, sore throat, things of that nature might indicate there might be concerns for COVID. Assuming they screen negative for that, we'll give them a mask to wear if they don't already have one. We'll ask them to sanitize their hands, and we'll use a contactless thermometer to measure their temperature. Once we confirm that their temperature is within the normal range, which is basically under 38 degrees, then we will escort them into the clinic. The clinic, of course, this is my clinic here, but clinics will usually have plexiglass available to protect both the patients and the team members serving them on the administrative side. They will then be entered into rooms. Many rooms will have actually new doors. These are temporary doors that have been put up to limit the aerosols that are being produced inside the room that's being produced, so it doesn't spread elsewhere in the office. And the patient will be asked to rinse with a certain mouthwash to reduce the amount of bacteria in their mouth. When they see their hygienist or their dentist, they'll notice there's additional gear they're wearing. For example, this person here in the picture we'll see is wearing a gown, disposable gown. They may also have a face shield on, which is not typical. The mask may even be a bit different. The protocols of the room itself, people are not allowed in with their friends anymore. We just ask people to wait in their car before being called in, and to come in only by themselves, not have friends or family with them. And then when the treatment is done, we'll ask them to put their mask on and return back to the front desk area to be reappointed for future visits.
Okay, nice. So, like, it's totally being changed. Like,
There's some changes. I mean, we're in a stage of pandemic where we have to be extra cautious. As the pandemic evolves, regulations and guidelines will change, and our approach to these preventive measures will also change. So sometimes this is all they'll see this one time here in June or July. Maybe when they come back in October or November, it'll be back to normal, or we don't know. Maybe things will be even worse back then.
So just a quick question. Like, I saw the waiting room. So what about the waiting room? Like, is there still a waiting room or no more anymore?
There is a waiting room. However, we're having patients call us or text us when they arrive to the parking lot to let us know that they've arrived. And then once the team member is available and ready to have them come into the office, then they'll be called or texted again.
So there is a special arrangements for these.
Yes, just for this time being. Thankfully, we're in the summer temperatures, so it's safe to be outside, whether someone comes in by bus or walking or by car. In the winter, hopefully, this pandemic will be behind us and things will be back to normal.
Yes. So, Dr. Ghamian, like, for example, my dentist's office is not open yet, and I think have a dental emergency. What should I do?
Well, first of all, let's classify what a dental emergency is. A dental emergency is a situation where somebody's having pain that can't be controlled with over-the-counter medications, i.e. with Advil or Tylenol. They've had dental trauma, they've fallen and broken something, or they have a swelling and that they're very concerned about that's starting to spread. Those are true emergencies. So those are things that dentists have been able to treat throughout this pandemic, and would try to utilize teledentistry as much as possible. And there's also urgent matters. For example, somebody who had a broken tooth and now that is cutting their tongue or their cheek, things of that matter that need to be dealt with in a timely fashion. Those are all considered dental emergencies or urgent care. There have been clinics open throughout this whole pandemic, limited that is though, because there's limitation how much personal protective gear that is available. So if your dentist is not open, usually when you call them, you'll be able to leave a voicemail, and they typically will call you back within 24 to 48 hours. If they can't handle the situation over the phone, they'll direct you to the dental office that's open, and that's available to hopefully alleviate those urgent concerns.
Okay, nice. Okay, so can my dentist just prescribe medications for over the phone, or like as you said, like telemedicine or something?
So they will, of course, they need to be a patient of record for them. They need to know who you are. They need to know your medical health. They need to have some background so they know that they're addressing you in the best way possible. And then, depending on the situation, if they think it can be handled via pharmaceuticals, i.e., antibiotics or painkillers, then that will be the route they will take. If they find that it's beyond that, if they're not prepared to see you in the office themselves, then they'll refer you to clinics which are available to see people on an urgent matter.
Oh, okay. So this is takes us to another level. So how to take care of our teeth before seeing a dentist?
Great question. So I mean, for the last 2 or 3 months, we've been telling our patients to try to focus primarily on prevention. Let's prevent emergencies from happening, as opposed to wait for them to happen and try to figure out how to solve it. So, of course, it's the regular recommendations that every person has heard when they've gone to their dentist. Stay consistent with your brushing, stay consistent with your flossing, avoid the crunchier foods. If you can use a mouthwash, go ahead and do so. That'll limit the amount of bacteria in your mouth and hopefully minimize disease. Those are the primary precautions there. And if you have concerns, don't be shy to reach out to your dentist, and they'll try to help you in whatever capacity they can.
Nice. And another question related to the COVID thing. So if a patient is experiencing some symptoms of COVID, so is there any special arrangements or special protocols for these patients?
Great question. So again, when patients are appointed for an appointment, they'll be screened over the phone the day before the appointment, and they'll be asked a series of questions. If they seem to have some yeses to the questions, like do you have a fever, are you having shortness of breath or difficulty breathing, those patients are best to be reappointed at a different date, typically 14 days later, when the symptoms have subsided, or they've gone to see their family doctor, or they've done a COVID test and they've tested negative for that. So usually things are not urgent; they can be dealt with over the phone. In the rare cases where they have to see a dentist, there's extra precautions that will be done. There'll be special gear that the dentist will wear. Typically they'll be booked at the end of the workday, so that there's no other patients in the office. And there's special precautions done to protect both the patient and the team members that are serving that patient.
Okay, nice. Dr. Ghamian, that was very interesting. So do you have like some recommendations, like, or some information you would like to share it with like patients, for example?
Well, just to know that, whenever you're seeing you went to a dental office, infection control is their top priority, to make sure that things are done in a way where there's benefit to you and there's no harm in terms of, or minimal harm in terms of potentially getting something while you're there. So the offices have all the equipment necessary, and they follow all the protocols necessary to take care of your health. That being said, expect changes. Don't expect things to be the same. You may find it's a little bit of a longer process to see your dentist because you're waiting in the car, perhaps. There's no more waiting in the waiting room. It's not as easy to see the dentist themselves because they're hidden behind a mask, a face shield, a gown. Things are perhaps a bit different than usual. So the small talk may not necessarily be there at this point in time. Hopefully this is transition phase and things will return to some sense of normalcy in the future. So expect changes for now. Hopefully as time goes on, things will improve.
Very nice. So Dr. Ghamian will read some questions that been sent to the page. We had some questions about the dental staff. Like, is the dental staff also being screened, like the same process with the patients?
Great question. So yes, indeed. Every morning when the team members come to the office, they have to answer a series of questions to confirm that they have no symptoms of COVID. If anybody does have symptoms, they're asked to stay home and get tested before and screen negative before they come back to the office, or stay home for 14 days. When they come to the office, their temperature is also taken to make sure it's within the normal range. And this is all documented on a daily basis. And throughout the day, if anybody does start having any concerns or symptoms, they identify themselves and they're directed to see their family doctor. And then we try to as well contain the situation and deal with it however is the best fashion
arrangement for patients and for staff.
Exactly.
And another question came regarding, like, we hear about some places that no more washrooms in that places because of the cleaning and hygiene. So what about dental clinics? Are there some regulations regarding these washrooms or something?
Well, we try to encourage patients that before they come to the clinic, they've used the restroom at their home. They've worn a mask and they come to the office. The restrooms are available. We're asking people if they can to avoid them as much as possible, just because that's a distant area where there potentially can be more risks of infections. Of course, all common surfaces in the dental offices are wiped down multiple times per day. Doorknobs and doors and any areas are common surfaces. But if you can avoid contacting things, it's probably better to use your restroom at home.
Mm-hmm. So we had some questions about the arrangements, and we spoke in detail about these and appointments. As you said earlier, that there is a screening being done before visiting the clinic. And so we had some questions about patients. Is it safe to wait in the waiting area? I think
it is. We're trying to respect social distancing as much as possible. So most waiting areas that we're familiar with, for example, might have 8, 10, 12 chairs, and they're all side by side, less than the acceptable social distancing. So, for example, in my clinic, we used to have 15, 16 chairs in the waiting room. Now we only have 4 or 5, which are 2 meters apart. So they still can be used. Let's say someone who can't stand up, or it's too hot outside and they're overheating. Of course, they can come and use the waiting room, but we're trying to minimize its use to, again, minimize the contact of people with solid surfaces and potential risk of cross-contamination.
Excellent. And I had a question. A question came about the air quality in clinics? Is there some like new regulations about air qualities in the clinic?
Great question. So first of all, it's important to know that the regulations are constantly changing as we find out more about this particular COVID-19 coronavirus. So the regulations and the guidelines continue to evolve. So what applied last month may not necessarily apply this month, may not necessarily apply next month. Currently, there are some timelines. So after a patient uses a treatment room, there's a certain period of waiting. It's called fallow time to allow any aerosols to settle. That period can be sped up if the clinics employ some HEPA filters through air purifiers. So that will exchange the air at a faster rate, remove over 99% of any viruses or bacteria in the air. And that allows the room to be utilized at a faster rate, perhaps. Some offices will have that ability to have those air purifiers. Some offices do not. As with everything else in COVID, try by Lysol, try by toilet paper. There's lots of things that are in short supply, including air purifiers. Some offices, like our office, we have more coming in this week and next week to purify the air.
I think this is like what delaying some of the dental clinics to be reopening to ensure the PPEs and like to be ready for the patients.
Definitely, personal protective equipment has been a challenge for the last couple of months to try to procure that and to have that available for our team to protect them and our patients has been a difficult challenge to say the least. There's also been lots of changes in pricing of these products. Some products that are now 5-10 times the cost of what they were only a few short months ago. So maybe even some patients, if they've gone to the office, they may find a small fee has been added to their procedures currently to partially offset some of these costs of these PPEs. It definitely won't cover it, but just to offset some of these costs. And we're hoping this is a one-time thing, so that next time they come in, there's no more price gouging on the supplies of these equipments, and hopefully there won't be any prices passed along to consumers.
So it's like it's the priority is the patient safety and the physician and the dentist safety and the dental team safety.
It's supposed to be make sure everyone's safe and not minimizing the risk of any cross-contamination.
Thank you very much, Dr. Ghamian. Do you would like to add something that we didn't address, like you would like to share it with the viewers?
Well, the one thing I'll mention is that we're very thankful that things are calming down because of the pandemic. We still need to be vigilant. We still need to follow procedures to ensure the safety of everyone. We thank all patients for being understanding in these times. And we're going to do the best we can to serve everybody in a timely fashion. We don't know what the future holds. These guidelines might change. There might be some further restrictions on dental offices or further easing. We don't know which way things are going. What I tell my patients, some of my patients are patients who travel 3-4 months at a time in the year. And they typically will see us before they travel to make sure that there's nothing is on the horizon in terms of potential emergencies. Nobody knows whether there'll be a second wave of this pandemic or not.
Yes.
God forbid there is a second wave. It's expected that if it's going to happen, it may happen in the fall. So what I'll tell patients is if you're able to see their dentist over the summer and potentially address things before they become an urgent matter later, you may save yourself from things that are not desirable should a second wave of pandemic occur.
Yes, nice. Thank you very much, Dr. Ghamian, for the great session. And it was a pleasure having you as a guest tonight.
Thank you so much for having me. I appreciate your time and your effort. I know you put a lot of effort into these programs, so I wish you all the greatest success.
Thank you, and good night.
Have a great night. Thank you so much, Tariq. Bye-bye.
So we were with Dr. Ghamian. I just have some updates that public health remains a top priority and we should continue to physical distance. We should continue to wear a face covering if physical distancing is a challenge. We should wash our hands frequently and we should avoid touching our eyes, nose, and mouth. And just a short reminder, next week we'll be having a guest from the Ottawa Public Health. Stay tuned and follow us on our social media platforms. And if you liked our broadcasts for tonight, please like it, follow it, and share it with your friends. Stay safe, stay healthy, and good night.